Collecting Colostrum, a guide for parents. Did you know that in pregnancy, your body starts to produce your baby's first milk? This is called colostrum. Learning how to hand express colostrum in pregnancy can be very useful. In this video, we will guide you through the process of collecting colostrum, the first milk your body produces for your baby. Your milk is unique for your baby. It is full of good bacteria that helps to protect and grow your baby's immune system. As your baby grows, your milk changes to meet their needs. It is more than food, it also provides protection and love. Some mothers or parents will choose to collect colostrum before their baby is born. Most mothers and parents can choose to do this to help them feel more confident. Collecting colostrum during pregnancy can be especially helpful for mothers and parents if they or their baby has a medical condition. Speak to your health visitor or midwife who can give you more advice. You can usually start collecting colostrum at around 36 to 37 weeks of pregnancy, but always check with your midwife or healthcare provider first. Before you start, take a moment to prepare. Make sure you've washed your hands and gather your supplies. You'll need a sterile syringe, cup or small container to collect your colostrum in. You could have a bath, put on some music, look at your scan photos, or talk to your baby before you get started. This will help you relax and connect with your baby. Now let's go through the steps of collecting colostrum. 1. Start by gently either massaging, stroking, or kneading your breast or chest, whatever feels comfortable for you, just for a few minutes. 2. Make a C shape with your thumb and finger, and then lightly work backwards, about 2 to 3 centimeters from the nipple. 3. Gently compress your thumb and finger. Hold it for a few seconds and then release. Be patient. In the first few days when collecting colostrum, it will not come out straight away. When it does come, it will appear as small droplets at the end of your nipple. Sometimes, you may need to move your fingers either forward or backwards a little bit. It's all about finding the right spot. 4. Collect these droplets into your sterile syringe, cup or small container. If you are using a syringe, place the tip at the end of the nipple and gently pull back on the plunger. 5. Once the flow slows down, turn your thumb and finger around the breast or chest to work on another area. Gently press and release until you see those small droplets of colostrum again at the tip of the nipple. 6. Once you have done this, you can then move on to your other breast. The key thing to remember is to find the right spot. Try to avoid sliding your thumb and fingers over your breast as this may cause bruising and soreness. 7. Once you have had your baby, you might want to continue to hand express. This could be for lots of reasons, such as to tempt your sleepy baby to feed during the early days, or to relieve full breasts, or if your baby cannot feed at that time, to provide them with medicine. As your colostrum changes to mature milk, your milk will flow more easily. You can harvest colostrum 2 times a day, for around 5 to 10 minutes per session. Be sure to stop if you feel any discomfort. It's normal for the amount of colostrum to be different each time you try. Once you've collected the colostrum, label the syringe with your name, date of birth, and the date and time. Also number the syringe so you know which you collected first. If you have collected a small amount of colostrum, the syringe can be used for your next time. The syringe can be stored in a sealed container at the back of the fridge for up to 24 hours. After that, it is best to put it in your freezer until you need it. If you are having your baby in hospital, you may wish to bring some of your colostrum to hospital with you. The best way to do this is to use a small cool box or bag with 2 freezer blocks. Place a freezer block at the bottom, your frozen colostrum in the middle, and a freezer block on top. Give this to the midwife who is looking after you and ask them to put it in the freezer until you need it. If you do not use it, please take it home with you. After your baby is born, you can use the harvested colostrum. You can feed it to your baby using your clean finger, a sterilised plastic spoon or a cup. Your colostrum you collected when you were pregnant can help while you and your baby are learning to feed in those first few days. If you have any questions or concerns, speak with your midwife, healthcare professional, or infant feeding team. Collecting colostrum should always be comfortable and safe. For more information, please contact your midwife, healthcare professional, or infant feeding support, or visit our website barnsleyhospital.nhs.uk/feeding your baby.